In the last section, we talked about glenohumeral elevation, basically, flexion and abduction and a little bit of scaption. So we need that if we're going to go pick fruit out of the trees or put our coffee cup up on the shelf or whatever we're going to do, elevating our arm. Upward rotation of the scapula is involved in elevation because 1/3 of the range of motion for shoulder abduction or flexion occurs from upward rotation of the scapula. So we get 120 degrees of glenohumeral rotation and 60 degrees of scapulothoracic rotation in order to get that full 180 degrees of elevation. So the upward rotation of the scapula also helps maintain the muscle length, that good length tension relationship of the glenohumeral joint abductors and flexors throughout their extensive range of motion. So if the scapula didn't upwardly rotate, a lot of the glenohumeral joint abductors or flexors would quickly become too short, and it would significantly reduce their ability to contribute to elevation torque, basically. So it would limit, we'd have to go for low-hanging fruit. We wouldn't be able to reach up and get the good stuff. Okay, so once we've got the arm up there, we got to get it back down, right? So gravity. Gravity can take it down, but with control, we want adductors and extensors, and the adductors and extensors also work in other functional movements that are important. So again, we're going to identify the muscle attributes, and we're going to look at possible active and passive insufficiency. The main adductors for the glenohumeral joint are the latissimus dorsi. Remember, it's got that big, broad attachment on the back, and then attaches to the floor of the bicipital groove and can pull the arm down. The Teres Major, it's the latissimus dorsi's little helper, so it does the same motions. And the Pectoralis Major has line of pull for adduction. Extensors include latissimus dorsi again, and remember that reversal of muscle function where the upper extremities are planted through crutches and you pull the trunk forward for crutch walking. Pec Major also has a line of pull for extension, posterior deltoid, and the long head of the triceps. So the biceps, both heads of the biceps cross the shoulder. Only the long head of the triceps crosses the shoulder. The medial and lateral heads of the triceps only cross the elbow. So the long head of the triceps is the only one that could be potentially a actively or passively insufficient muscle in the shoulder. So horizontal adductors and abductors, I like the way they said it in the book. They called it horizontal abduction and adduction is flexion and extension turned sideways. Totally makes sense, because if you think of like a chest fly, when you do horizontal adduction with your pec major and your anterior deltoid, that's flexion sideways, basically. And then horizontal abduction is the posterior deltoid, that's extension sideways. That really makes sense to me when they say that. So shoulder flexion and extension occur about a medial lateral axis of rotation in the sagittal plane. The muscles that course anterior to the medial lateral axis perform flexion, and muscles that are posterior to the medial axis perform extension. For horizontal abduction and adduction, they occur about a vertical axis of rotation. So muscles with a line of pull anterior to that perform horizontal adduction. So anterior deltoid and pec major. Muscles with a line of pull posterior to the axis, that vertical axis of rotation, perform horizontal abduction, and posterior deltoid is the only one that does it. So if you're doing bent over flies, you're using your posterior deltoid for horizontal abduction. So latissimus dorsi is a big extensor. Some people call it the great extensor, and it extension, adduction, and hyperextension of the shoulder. So extension meaning return to anatomical position from the flexion, and hyperextension means going past anatomical position into further extension. And adduction is returning in the frontal plane. So the latissimus dorsi does all that stuff. And it does it well because it's a big muscle. So the I've heard the latissimus dorsi has a bunch of nicknames, but the great extender is one of them. And a lot of those big muscles that do big functional motions have little helpers, and the latissimus dorsi is no exception. It has a little helper of the teres major. So the teres major, same movements, extension, adduction, and medial rotation of the humerus. Its origin is the inferior angle of the scapula, and its insertion is the crest of the lesser tubercle, medial to the latissimus dorsi attachment. So if you think in order from the crest of the lesser tubercle, you have the teres major, the floor of the bicipital groove is the latissimus dorsi, and the crest of the greater tubercle is the pectoralis major. So some people remember it by saying the it's a lady between two majors. So the lady is the latissimus dorsi, and the majors are teres major and pec major. I don't know if that works for you, but I've heard that. So crest of the greater tubercle, pec major, floor of the bicipital groove, latissimus dorsi, crest of the lesser tubercle, teres major. So a lady between two majors. So it does all the same things that the latissimus dorsi does: extension, adduction, and medial rotation, and it gets the lower subscapular nerve, which kind of makes sense. It's on the lower part of the scapula, subscapular nerve. Makes sense. So the clavicular head of the pec major, we talked about it for shoulder flexion to 90 degrees. For medial rotation, that's hopefully that motion's obvious, and horizontal adduction. So that line of pull from the clavicular portion just really makes sense for that. With the sternal portion, it's from the lateral manubrium to the sternum and costal cartilage of the first 6 ribs to the crest of the greater tubercle of the humerus. So same insertion point as the clavicular head. It does shoulder extension to 90 degrees. So from here, it has that line of pull to come down to 90 degrees, but then it doesn't really have a line of pull to go lower than that. It does shoulder adduction and medial rotation. And it gets the same nerve as the clavicular portion and the pec minor, the lateral and medial pectoral nerve. So the long head of the triceps brachii, it's big player at the elbow, right? It's the major extensor of the elbow, but the long head also attaches to the shoulder and does some shoulder extension. So it descends between the teres major and the teres minor. So it sort of interweaves. It's pretty neat the way it interweaves between those two muscles. And it inserts on the olecranon process. It assists with shoulder extension. It's not like the major shoulder extensor. We're talking latissimus dorsi there, but it's assisting. So sometimes you say you're going to do some triceps exercises and you're doing like bent over tricep kickbacks. You can also do straight arm shoulder extension and still work the triceps. So triceps, the long head anyway of the triceps, they get the radial nerve, as do many of the muscles on the posterior side of your upper arm and the lower arm. So we're starting to get now into the peripheral nerves of the upper extremity, and we'll see more of those when we get to the elbow.